the objectives, and the terms. Different suturing techniques are continuous or running, which is normally one strand. Subcuticular, where you close the skin by running a stitch just underneath the skin to approximate the edges. A purse string to close a lumen, which is an opening. Interrupted, that's where the suture is cut and knotted individually. And retention sutures used in abdominal surgery. They usually have bolsters to prevent suture from cutting into the patient's skin. Usually the incision is closed under tension. Locking sutures add strength to a running suture by passing the thread under the loop when it is thrown. When handling the needle, load the suture from the package. Pass on the exchange basis and do not lay the suture on the patient. If the needle breaks, account for all the parts. Needles are counted when they are open and after they are used to make sure that you have what you started with. Utilize your needle book. Implants are used to replace or augment the patient's tissue. The patient may have a cut or burn that has damaged their tissue and needs some type of replacement. They can take the tissue from the patient, which is called an autograft, or they can use donor tissue, which is called an allograft. Grafts come from different sources, such as bovine or porcine. Then you have synthetic implants that include artificial joints, pacemakers that have been approved and regulated by the FDA. Stainless steel, titanium, and other alloys are used in orthopedics or neuro, which can include screws or plates. Methylmethacrylate is a bone cement used to secure in prosthetic joints in place and used for cranioplasties. It kind of smells like working in a nail salon when you mix a cement. The purpose of drains are to remove any fluids such as serous fluid or blood to aid in the healing process and help prevent it from becoming a medium for bacterial growth. It is normally placed at the end of the surgery before closing the incision. When placing a drain, it should be lower than the incision to prevent backflow into the incision. Passive drains are used for smaller incisions and those that the surgeon does not expect a lot of drainage. For example, when removing wisdom teeth, a passive drain may be used. Another type is a gravity drain that is inserted into a hollow structure, for example, a fulvi. Suction drains are used with a reservoir and uses negative pressure to pull fluid from the drain. For chest traumas, a chest tube drainage system is used. It's a water-sealed drainage system that's used to pull fluid or air from the thoracic cavity. The thoracic cavity is normally under negative pressure. That is what allows the lungs to inflate and deflate. So when your chest cavity is punctured, it loses the negative pressure. The drainage system replaces the pressure so the lungs do not deflate. A stoma pouch is used to collect body fluids following a stoma surgery. A stoma is a small opening on the surface of the abdomen that has been surgically created in order to divert the flow of feces and or urine. The bag collects fluid, allowing the body time to heal. It is also a reversible surgery. Dressings that are used are placed over incisions at the end of surgery to keep the incision clean. The different types of dressings perform different functions, such as cushion, absorption, or wrapping limbs. The most common is a flat dressing, which is a thin non-stick pad, sometimes secured with tape. Pressure dressings provide slight pressure on the incision or grafts to prevent fluid buildup, which can cause delayed healing. Support dressings are used to prevent or limit movement of a limb, for example, a cast. Healing starts as soon as the incision is made. It begins with the inflammation of the tissue, formation of a scab, and then around day 5, the ground substances for new tissue is forming. The scab goes away, leaving a new layer of tissue. The last phase begins about 3 weeks after. As some wounds heal, they contract and leave a scar. Some contracted tissue, depending on what area, can cause mobility problems. A keloid scar is when excess collagen is produced during the proliferation period. Wound healing is classified on whether or not the incisions are closed or left open. Secondary intention is a wound that is not sutured together. Healing time takes longer and sometimes needs a skin graft to close. Third intention is when the wound is left open and packed. Usually the wound is infected or contaminated. Once the infection is gone, the wound is closed. Some things that can affect healing are the immune system. If it's weak due to therapy, chronic disease such as diabetes, that can make the tissue weak. Nutrition and obesity does your Some things that can affect healing are immune system. If it's weak due to therapy, chronic disease such as diabetes can make tissue weak. Nutrition and obesity does your body have the adequate nutrients and blood supply to heal. Your age, and how the surgeon handled the tissue during dissection. All of these can affect the healing process. Surgical site infections can occur at any time, but it's usually during the first week after surgery. The first sign is inflammation and discharge from the incision. As soon as an infection is suspected, medical staff take immediate action. This can be in the form of antibiotics or washing out the wound and removing dead tissue, which is called debridement. A seroma is a collection of serous fluid that prevents the tissue edges from healing. A hematoma is a blood collection that forms because of either there's a bleeder that was missed or the patient's blood didn't clot fast enough. Dehiscence is a breakdown of the tissue edges that does not allow for the incision to close. If the tissue is inflamed, it could be infected with pus, which would mean an infection and would delay healing. Evisceration is when the abdominal contents that should be inside the body are now on the outside. It usually starts through a space where the incision was not closed tight enough. If this happens, immediate surgery is needed to put the contents back and keep the tissue hydrated so it does not dry out and die. Adhesions are a band of scar tissue that forms between the abdominal or pelvic organs and peritoneum. It usually forms after surgery or infection. Adhesions can be painful, and sometimes surgery is needed just to remove the adhesions.